Hi, I am Dr. Vishwak Sena Reddy, consultant neurosurgeon, Star Hospitals, and accompanying me is Dr. Anitha Kotha, who is our consultant neurophysician at Star Hospitals. As part of our Let's Talk Health program, 14th episode, we will be discussing about epilepsy, what are the causes and how to deal with epilepsy. So, starting off, so what exactly is epilepsy, Dr. Anitha? Is it like they call like fits, seizures, epilepsy? Are these all the same terms or they are different? How do you deal?
Yeah, almost same terms. Seizure, first we should know about seizure. Seizure is an abnormal, spontaneous, abnormal burst of electrical activity in the brain which manifests clinically either as abnormal motor or sensory or psychomotor activity in the body. That episode is called as seizure. So if the person has tendency to develop more and more episodes, such episodes, seizure episodes, that is called as epilepsy. If a patient develops 2 or more episodes, then we call it as epilepsy. So, and epilepsy, fit and seizures are used as synonymously. We call తెలుగులో అయితే మనం మూర్ఛ వ్యాధి సొమ్మ అని కూడా అంటూ ఉంటాము కామన్ టెర్మినాలజీలో. సో ఫస్ట్ ఎపిసోడ్ కనబడితే దాన్ని సీజర్ అంటాము. ఫర్దర్గా వాళ్ళకి టెండెన్సీ ఉండి అగైన్ అండ్ అగైన్ ఇఫ్ దే హ్యావ్ దట్ టెండెన్సీ టు డెవలప్ సీజర్, then it is called as epilepsy. It's a disorder, it's not a disease. It's a disorder like diabetes and hypertension, which needs long-term medication and regular medication. So like that, epilepsy also needs medication. It's not a disease which will not affect the other organs in the body.
Okay. So what exactly causes this?
So there are various causes for seizures. Seizures, different age groups, any age group can be affected with seizure. So it is not the only childhood problem, not one age group problem. It can affect in any age group from birth till 60 plus years of age. So, but it depends on the depending on the age, various reasons are there to have that seizures. So if we divide the age group from birth to 2 years, at birth also seizures can happen, especially when abnormal delivery problems like prolonged labor, డిలేడ్ క్రై అలా ఉన్నప్పుడు ఆక్సిజన్ అందక బ్రెయిన్లో బ్రెయిన్కి ఆక్సిజన్ అందకపోవడం వల్ల సీజర్ రావచ్చు, కాల్షియం లెవెల్స్ డ్రాప్ అయ్యి సీజర్ రావచ్చు, ఆర్ గ్లూకోజ్ లెవెల్స్ అంటే బేబీ ఫీడింగ్ ప్రాపర్గా ఇవ్వకపోతే, బ్రెస్ట్ ఫీడింగ్ ప్రాపర్గా ఇవ్వకపోతే, ఆర్ గ్లూకోజ్ లెవెల్స్ 1-2 డేస్లో పడిపోయి సీజర్స్ రావచ్చు 1-2 డేస్లో. తర్వాత అలాగే డెవలప్మెంటల్ మాల్ఫర్మేషన్స్, మామూలు అంటే బ్రెయిన్లో డెవలప్మెంటల్ డిఫెక్ట్స్ ఉండడం వల్ల కూడా ఆ ఏజ్ గ్రూప్లో ఫిట్స్ రావచ్చు. అండ్ ఇప్పుడు ఈ బర్త్ రిలేటెడ్ ప్రాబ్లమ్స్, డెలివరీ రిలేటెడ్ ప్రాబ్లమ్సే కానీ గ్లూకోజ్ రిలేటెడ్ ప్రాబ్లమ్స్ అయితే ఇవే ప్రివెంటబుల్ కాజెస్. సో డెలివరీ ప్రాపర్గా యాంటీనేటల్ కేర్, డెలివరీ కేర్ ప్రాపర్గా ఇస్తే అది ప్రివెంట్ చేయొచ్చు, గ్లూకోజ్ లెవెల్స్ అవన్నీ చూసుకుంటే, ఫీడింగ్ అదంతా చూసుకుంటే. సో అనదర్ థింగ్ ఏంటంటే ఫెబ్రైల్ సీజర్స్ అంటాం. ఫీవర్తో కూడా ఫిట్స్ రావచ్చు. 6 months to 6 years of ఏజ్ గ్రూప్లో విత్ ఫీవర్ దే కెన్ హ్యావ్ సీజర్. సో దట్ ఈస్ కాల్డ్ ఎస్ ఫెబ్రైల్ సీజర్. And another infantile seizure disorders are also there which can affect this age group. And in between 2 to 12 years of age, there are various other reasons like the same thing like hypoglycemia at the time of birth or hypoxic injury at the time of birth. If they'll have tendency to develop seizures in this age group. And also febrile seizures also can have till 6 years of age group. And in school going age, they can have absence epilepsy, absence seizures. So absence seizure means that is a sudden cessation of the activity. The child will stop doing the activities at that for few seconds, like let's say 10 to 15 seconds. They will stop that activity while eating or talking or writing, school children. So most of the times it is identified by either mother or school teacher. So this can happen at recurrent episodes in a day, and which does not, most of the time does not require any treatment also. After some period of time it will subside. Another condition which we should know which is a preventable cause is neurocysticercosis, that is infection, worm infection in the brain. So this occurs because of improperly cooked vegetables or improperly washed fruits. If they contaminated, if we eat those things, and that warm helminth can go into our intestine, and which will lay eggs, and the eggs will carried into the brain, and the larval form will go into the brain, and it can lodge in the brain. It can cause scarring and calcification in the brain, which can trigger the seizures. So that is very important to know, because if it is food is contaminated, people can develop this kind of neurocysticercosis and seizures. So by taking properly washed and properly cooked food, we can prevent this. And another cause in this group, children developmental malformations also can cause epilepsy in this age group. And from 12 to 40 years of age group, the same thing: absence epilepsy, juvenile myoclonic epilepsy, slow glowing tumor, as you know. And this juvenile myoclonic epilepsy, especially, they will have GTCS type of seizures along with sleep deprived jerks. They can have sudden jerks, which during that time they will drop the things. That kind of jerks, sleep deprived and early morning jerks, can happen. So this will have some genetic tendency, familial tendency, and which is treated differently, which we should know about that condition, and which needs different kind of treatment when compared to other seizure types. So, and slow growing tumors, vascular malformations, and especially
AVMs.
nowadays, AVMs. And again, this part of the city, and nowadays we are seeing more of drug abuse cases,
definitely.
alcohol. Increased intake of alcohol can cause seizure, excess alcohol can cause seizure, withdrawal can cause seizures, and especially road traffic accidents. If they don't wear helmet, and they will have head injuries. Head injuries immediately can cause seizure, and after few years also, because of the leftover scarring also can cause seizure.
Post-traumatic seizures.
Yes, post-traumatic seizures. So all these things can happen. And beyond 40 years of age, like same thing again, the road traffic accidents, alcohol related, especially stroke. So if they have diabetes and hypertension, they will develop strokes, and because nowadays stroke incidence also increasing because of the increased sedentary lifestyle, increased stress, and addictions, and all these things are increasing the stroke tendency, and the stroke will cause damage in the brain, which can cause seizures in future. So, and another thing is diabetes. Diabetes also can cause, if they have increased sugar levels also, they can have seizures, and decrease in the sugar level. Hypoglycemia also can cause
fluctuations in the blood
sugar levels also can cause seizure in this age group. And another important thing is tumor. Tumors also can cause seizures. So again, beyond 50, 60 years of age group, all these things, again, the tumors, strokes, especially
bleed in the
brain,
trauma
again, and they have, especially 60 years of age group, they'll have tendency to fall tendency will be more. They'll have head injuries because of the falls, and strokes, and some kind of rapidly progressive dementia also lead to seizures in this group. Low sugars, low sodium also can cause seizures in this age group. Because especially if they use some of the antihypertensive will cause low sodium levels, which can cause seizures in this age group. These are all various causes of seizures, and some are preventable causes are there, which can be prevented by taking proper care.
So what I basically understand is there is either a chemical change in the brain which is leading to seizure, or there is a structural change in the brain which is leading to seizure. So, how often, how do you see patient types, as we were discussing about the different types of seizures? So, is it always necessary that the patient should always become unconscious, fall down, or there are other ways of manifestation?
Yes. Like I said, seizure itself is a manifestation of abnormal electric activity in the brain, either in the form of abnormal motor, sensory, psychomotor. So it can manifest differently. So most of the times people think that it is like unconscious, they will have tonic-clonic movements, lung bite, and all those things. That is a kind of seizure which we see commonly, that is called as GTCS, generalized epilepsy. So epilepsy can be focal or generalized. This kind of seizure is a generalized
Generalized.
epilepsy, which may not be because of one focus in the brain. But other kind of epilepsies which we should know, because that is because of the focal area in the brain which is causing the seizure. So we should know about these manifestations so that we can find out the focal abnormal focus in the brain, which may be because of some tumor or scar or calcification or vascular malformation, which needs to be treated. So like that, the focal epilepsy. In the focal epilepsy, they may present with either abnormal motor activity. It can be like a simple clonic one side. Focal means they may not have any unconsciousness or unawareness. They will be aware of the things what is happening to them, and they may have some sudden clonic movement. This is called as clonic epilepsy, or sudden tonic movements. Clonic movement, or atonic, loss of tone, complete they will fall.
Fall down.
So fall down. So that is a motor kind of seizure, which will represent motor cortex in the brain, as you know.
Yeah.
And sensory. So if the seizure focus is coming from sensory area in the brain, they will have sensory abnormal sensations like tingling sensation or burning sensation in one hand or one side of the body.
Abnormal sensation of
Abnormal
smell.
sensation of the smell,
Yes.
especially in the temporal lobe epilepsies.
Yes.
Because temporal lobe controls most of the memory, our emotions, behavior, and all those things are controlled by temporal lobe. They can have different manifestations of temporal lobe. Like they can have abnormal perception of the smell for a brief period, abnormal taste, or dijua, over familiarity or unfamiliarity, or abnormal movements like chewing movements, automatisms like movement. These kind of presentations can happen, but patient may be aware of the things. If it is other kind of epilepsy is complex partial. Complex partial, they have these kind of presentation with unawareness.
Okay.
That is called as complex partial. Sometimes this simple partial things can be an aura of generalized epilepsy.
Okay.
So they can present as a warning symptom of generalized
Followed by the
epilepsy,
generalized.
followed by generalization.
Okay. So, what are the do's, Mane? How do you, what is the suggestion you give to patients when, for suppose he's a patient is a diagnosed case of epilepsy, what are the precautions they need to take, how they can prevent, or what is the changes they have to do?
Oh. So, if the person is having epilepsy, the epilepsy is a disorder, as I said, they need to take medicines. If they take medicines regularly, it will be under control. Most of the seizures, 80%, 60 to 70% are well controlled with medicines. So taking regular medicines is very important, and some of the lifestyle changes like stress. The epilepsy seizure can be precipitated by lack of sleep, stress, increased screen time, increased concentration near the screen, and these lack of food, all those things. Fasting can also
Even alcohol.
precipitate alcohol and drugs, illicit drugs. All these things can precipitate seizure. So in that case, doing only taking medicine is not the only thing which is required, and controlling these things also very important.
Okay. So whenever a patient first notices that somebody is noticing, so what advice should we give? What are the first aid we need to give to the patient?
That is very important. So when we see a simple partial seizure, simple seizures, they don't require anything. That will stop within few minutes or seconds. But if we see a patient having generalized tonic-clonic seizure, we should not run away, and we should not crowd. People should not crowd make a crowd near the patient. So it's just put the patient in a side position to prevent secretions, aspiration into the lungs, and
because there is
prevent
generally
falls.
frothing.
Yeah, generally the secretions will increase. So that they can get aspirated, and they will have aspiration pneumonia. To prevent that, we have to put the patient in side position, We should not put anything in the mouth. Don't give any spoon, don't put water or spoon in the mouth. Don't try to prevent tongue bite also. Okay, and should prevent from falls. And if the tight clothing is there, we should loosen the clothes. This is the only thing we should do. If the seizure lasts beyond 3 minutes, we should immediately take a hospital. We should
So
take,
they should be
take it
taken to the nearest
hospital.
hospital first,
Nearest
because
hospital.
many times what the patient says, stay far away from the actual
Nearby,
being
yes,
treated. So what we should be suggesting them is go to the nearest
to the
hospital
nearest
first for the first aid, followed by the primary
Yeah.
doctor wherever they
Yes,
have been
yes.
seeing. So what is the most common cause for the recurrence of seizures to be happening? Because there are many patients who come back saying, doctor, I have been taking medicine, but still I have seizure. So most of the times drug
Most
complaints.
of the times drug complaints.
Yes.
Complaints is the major.
They don't take miss a
major,
dose or skip a dose.
Some people will say, I have taken alcohol, so I didn't take the
Take
medicine.
the medicine, true.
So they actually, in that case, it requires more. He has to take the medicine. So they will skip. And some people, because I got pregnancy, so I stopped. Already, women with epilepsy is very important to know the what precautions need to be taken. So when they get pregnant, they will stop the medicine and they will develop seizure and come. So during pregnancy, need not stop. Just consult neurologist or physician. And we need to change the medicines during that time, because some medicines will cause birth defects. To prevent that, we will change the medicine. So in children also, sometimes school-going children, because of sleep, drowsiness and all those things, parents tend to avoid the medicines and send them to school. So that compliance is very much important.
So drug compliance is the most important. And there are also instances where the patient tells us that they have been taking medicines regularly, but in spite of that, they develop seizures. So what do they need to do? They need to increase the dose or add on drugs, or what should they do?
In that case, the diagnosis, what type of epilepsy, that is important. And dose, whether the dose is adequate or not, we should see. And we should check the levels if required. And depending on the diagnosis of epilepsy, we need to change the medicine. Sometimes we may have to add the medicine, another anti-epileptic agent. We may have to increase the dose of the anti-epileptic drug. And we need to check whether the lifestyle habits and all those things, whether they are good or not. These things need to be taken care.
So there are instances again where the patient says, we have been taking all the medicines regularly, add-on drugs have been taking, but still sometimes the epilepsy is refractory to the
refractory. This is if the epilepsy is not controlled in 6 months to 2 years, if they keep on getting seizures, the other option is surgical option.
Okay.
So we need to evaluate for the surgery, and we need to do prolonged video EEG monitoring and other scans, which will identify the focus of the seizure, and we need to send them for the surgery also.
Okay.
So especially in temporal lobe epilepsy, they do medial temporal sclerosis. Most of them respond to surgery. Around 60% of the patients respond to surgery.
Because many a times what happens is patients coming from periphery, they directly come asking for a surgery. I don't think that is correct. We need to evaluate only because they think that we can stop taking medicine. And surgery is definitely an option, but that is only in case of refractory epilepsy, just to improve the quality of life. And they should also understand that even after surgery, they might need to continue their anti-epileptic drugs. Okay. So other important topic we need to discuss is like what are the common myths? They have certain apprehensions like, doctor, do these seizures, like my child has seizures, especially febrile seizures for that case. So do febrile is the seizures curable? That is the first question they generally ask. And do they need to continue using medicines for how long? That is another question they commonly ask.
Febrile seizures doesn't need continuation of medication. If generalized seizure only occurring during the high-grade fever episodes, they will the main thing is to control the temperature. That is the main important thing, and along with that, brief period of anti-epileptic medication, maybe for 4 to 6 weeks of anti-epileptic medicine. They don't require prolonged medications.
course,
Yes. And the coming to the myths actually, so చాలా మందికి అపోహలు ఏముంటాయంటే ఎపిలెప్సీ అనేది చాలా పెద్ద డిసీజ్, సో ఇది వస్తే ఇంకా ఇంకేం చేయకుండా ఆగిపోతారు ఇంకా. సో ఇది పెద్ద పెద్ద డిసీజ్ కాదు. చిల్డ్రన్ మామూలుగా స్కూల్కి వెళ్ళొచ్చు, వాళ్ళ ఎడ్యుకేషన్ కంటిన్యూ చేయొచ్చు మెడిసిన్స్ తీసుకుంటూ కూడా. చాలామంది హయ్యర్ ఎడ్యుకేషన్కి వెళ్ళి చాలా లైఫ్లో పెద్ద పెద్ద పొజిషన్లో ఉన్న వాళ్ళు కూడా ఉన్నారు. మామూలుగా ఎవరి జాబ్ వాళ్ళు కంటిన్యూ చేసుకోవచ్చు. ఎస్పెషల్లీ ఉమెన్, వాళ్ళకి ఇంకా సీజర్ వచ్చింది అంటే మ్యారేజ్ చేయడానికి భయపడతారు, మ్యారేజ్ చేసుకోవడానికి భయపడతారు. కామన్ ట్యాబు అలాంటిది ఏమీ ఉండదు. మామూలుగా నార్మల్గా వాళ్ళకి ప్రెగ్నెన్సీ వస్తుంది. ఓన్లీ థింగ్ ఈజ్ వాళ్ళు మెడిసిన్ వాడుతున్నప్పుడు ఫోలిక్ యాసిడ్ ట్యాబ్లెట్స్ తీసుకోవాలి. మ్యారేజ్ చేసే ప్లాన్ ఉన్నప్పుడు ఫోలిక్ యాసిడ్ కూడా మెడిసిన్స్ సప్లిమెంట్ ఇస్తే ఫర్దర్గా వాళ్ళకి బేబీకి ప్రాబ్లం రాకుండా ఉండడం కోసం. బట్ మెడిసిన్స్ కంటిన్యూ చేయొచ్చు, కాకపోతే కొన్ని మెడిసిన్స్ ఇవ్వకూడదు, దాన్ని కన్సల్ట్ చేయించి చేంజ్ చేసుకోవాలి. Yeah, we need to change.
So there are safer drugs also.
Which can be given in pregnancy.
Yes.
So చాలా రకాల మెడిసిన్స్ ఉన్నాయి, అవైలబుల్ ఉన్నాయి. ఉమెన్ కూడా ప్రెగ్నెన్సీ అండ్ ఫ్యామిలీ అంతా కంటిన్యూ చేసుకోవచ్చు. ఇంకా కొంతమందికి అపోహలు ఏముంటుందంటే ఇది చాలా ఒకరికి వచ్చి ఇది కంటాజియస్ డిసీజ్ అని కొంతమంది అనుకుంటారు, విచ్ ఇస్ నాట్
ట్రూ.
అండ్ ఇది వస్తే ఇంకా ఫ్యామిలీలో వచ్చేస్తుంది, ఈమెకి ఫిట్స్ ఉన్నాయంటే పిల్లలకు కూడా వచ్చేస్తుంది, పిల్లలకు పుట్టే పిల్లలకి అని. అదంతా అపోహ మాత్రమే. చాలా రేర్ ఇది జెనెటిక్గా. కొన్ని డిజార్డర్స్ ఉంటాయి, ఇది జెనెటిక్ కాదు. ప్రెగ్నెన్సీ వాళ్ళు నార్మల్గా ప్రెగ్నెన్సీ పిల్లల్ని కనవచ్చు, అంతా లైఫ్ అంతా నార్మల్ లైఫ్ ఉంటుంది. ఓన్లీ థింగ్ ఈస్ దే హ్యావ్ టు టేక్ ద మెడిసిన్స్ ఆన్ రెగ్యులర్ బేసిస్ అంతే.
ఎనీ డైటరీ రెస్ట్రిక్షన్స్, ఫుడ్లో ఏమైనా మార్పులు చేయాల్సి ఉంటుందా?
ఇది చాలా మందికి అనదర్ క్వశ్చన్. ఇందులో అసలు ఎపిలెప్సీ ఉన్నంత మాత్రాన మన డైట్ ఏమీ రెస్ట్రిక్ట్ చేసుకోనక్కర్లేదు, నార్మల్ డైట్ తీసుకోవచ్చు. ఓన్లీ చాలా రిఫ్రాక్టరీ ఎపిలెప్సీ వాళ్ళకి మాత్రం కీటో డైట్ అడ్వైస్ చేస్తాం. అది స్పెషల్ కేసెస్లో అది డైటీషియన్ ప్రకారంగా మీ కన్సల్ట్ అయ్యి ఆ కీటోజెనిక్ డైట్ తీసుకోవచ్చు. బట్ అదర్వైజ్ మేజర్ డైట్ రెస్ట్రిక్షన్ ఏ ఉండదు. ఓన్లీ ఆల్కహాల్ నీడ్ టు బి అవాయిడెడ్ and other drugs need to be avoided. That's it.
Another common mistake the patient generally they do is they have been using medicine for a long time, they don't have seizures and they stop the medicine, they come back with a seizure activity.
Yeah.
So how long generally we need to prescribe the seizure medication?
If proper epileptic disorder, epilepsy is diagnosed, 3 to 5 years of continuation medication is required. సో ఆ 3 to 5 yearsలో కూడా ఫిట్స్ రాకూడదు. 3 to 5 years తీసుకొని మధ్యలో ఫిట్స్ వచ్చినా అగైన్ 3 to 5 years వీ హ్యావ్ టు కౌంట్ ఫ్రమ్ బిగినింగ్ సీజర్ ఎపిసోడ్ నుంచి. 3 to 5 years వరకు మెడిసిన్ కంటిన్యూస్గా తీసుకొని ఆ పీరియడ్లో ఫిట్స్ రాలేదు అని అంటే స్లోగా టేపర్ చేసి స్టాప్ చేస్తాము. అనదర్ 3 to 6 monthsలో టేపర్ చేసి స్టాప్ చేస్తాము. సో ఇంకా కొంతమంది ఎస్పెషల్లీ ఆక్యుపేషన్ హజార్డ్స్ ఉన్న వాళ్ళకు కూడా కొన్ని ఆక్యుపేషన్స్ కూడా వాళ్ళ డ్రైవర్స్ లైక్ పైలట్స్ కొంతమందికి మాత్రమే రెస్ట్రిక్ట్ చేస్తాము యాక్టివిటీస్, అదర్వైజ్ నార్మల్ లైఫ్ లీడ్ చేయొచ్చు.
So they should also take care that they will not be driving, they should not be certain occupations they need to change,
like
high dangerous because they can develop a seizure at any point of time. They need to be careful. So what are the common investigations we order for? What is the because they come back, doctor, should I get a EEG always? What are the investigations we generally ask for?
Initially taking proper good history is very important to diagnose what type of epilepsy. And another thing is EEG also we can identify the type of seizure, so that it will guide for the management treatment. And MRI also, to rule out, as I said, secondary causes
tumor
like
or
tumors,
bleeds,
AVMs, scars, all those things, neurocystic sarcosis, infections, అవన్నిటి కోసం MRI చేయాల్సి వస్తుంది డెఫినెట్గా. సో CT కూడా హెల్ప్ అవుతుంది, బట్ మోస్ట్లీ MRI is a better investigation. ఎంఆర్ఐ చేస్తే మనకి కాజ్ కూడా ఐడెంటిఫై అవుతుంది, దాన్ని బట్టి ట్రీట్మెంట్ ఉంటుంది.
Okay. So another question commonly the patients ask is like, for suppose the lady is in diagnosed case of pregnancy, diagnosed case of seizure, should we conceive or not? That we have talked about. They can safely conceive.
Yeah.
And the only thing we need to emphasize on is like, if they are the girl is getting married, she's getting pregnant. Probably, if they are planning the pregnancy, they have to change the anti-epileptic drugs.
Yes,
That's what we need
and
to.
they have to take supplements,
Supplements.
folic acid supplements.
Yeah. And the most important thing is they should not be stopping the medication.
మెడికేషన్ ఎస్పెషల్లీ డ్యూరింగ్ ప్రెగ్నెన్సీలో సీజర్ వచ్చింది అని అంటే బేబీకి కూడా హైపాక్సిక్ ఇంజరీ జరిగే అవకాశం ఉంటుంది, బ్లడ్ సర్క్యులేషన్ తగ్గే అవకాశం ఉంటుంది. సో బేబీకి కూడా ప్రాబ్లం అవుతుంది కాబట్టి ప్రెగ్నెన్సీ టైంలో షుడ్ నాట్ మిస్ యాంటీ-ఎపిలెప్టిక్
drugs. Okay.
అండ్ అనదర్ థింగ్ ఈజ్ ఆల్ ఫస్ట్ సీజర్ మే నాట్ రిక్వైర్ ట్రీట్మెంట్. ఒక సింగిల్ ఎపిసోడ్ అలా వచ్చింది అని అంటే ట్రీట్మెంట్ ఇవ్వాల్సిన అవసరం ఏం లేదు. యూజువల్గా ప్రవోక్డ్ సీజర్స్ లైక్ అంటే ఇప్పుడు నేను చెప్పినట్టు సోడియం లో అవ్వడము, ఏదైనా కాజ్ ఉన్నప్పుడు సమ్ కాజ్ లైక్ ఒక్కొక్కసారి మనకి ఇప్పుడు మన దగ్గర చాలా సిఏబీజీలు అవుతూ ఉంటాయి, సర్జరీస్ అవుతూ ఉంటాయి, లివర్ ట్రాన్స్ప్లాంట్లు అవుతూ ఉంటాయి. వాళ్ళకు కూడా సర్జరీ టైంలో కూడా సీజర్ వచ్చే అవకాశం ఉంటుంది కొంతమందికి. సో అట్లాంటి కాజ్ ఉన్నప్పుడు సోడియం లెవెల్ డ్రాప్ అవ్వడం వల్లనో, షుగర్ లెవెల్ డ్రాప్ అవ్వడం వల్లనో, ఇన్ఫెక్షన్ ఉన్నప్పుడు, ఇన్ఫెక్షన్ సెప్సిస్లో కూడా ఫిట్స్ రావచ్చు. సో అట్లా ఇన్ఫెక్షన్ ఉన్నప్పుడు వేరే కాజ్ వల్ల వస్తే ఇది యూజువల్గా అంత లాంగ్ టర్మ్ మెడిసిన్స్ ఇవ్వాల్సిన అవసరం ఉండదు. 6 weeks to 6 months మెడిసిన్స్ ఇస్తూ ఉంటాము. అండ్ మన జనరల్ పాపులేషన్లో కూడా ఒక 1% ఆఫ్ ద పీపుల్ హ్యావ్ టెండెన్సీ టు హ్యావ్ సీజర్ వన్స్ ఇన్ ఏ లైఫ్ టైం. సో వాళ్ళకేం ట్రీట్మెంట్ ఇవ్వాల్సిన అవసరం ఉండదు. అంటే వాళ్ళకి ఏదైనా స్ట్రెస్ వల్లనో, స్లీప్ డిప్రైవేషన్ వల్లనో, ఈ లైఫ్ స్టైల్ వీటి వల్ల ఆల్కహాల్ తీసుకోవడం వలన ట్రిగ్గర్ అయ్యి రావచ్చు. అలాంటప్పుడు ఆ స్ట్రెస్ తగ్గించుకోవడము, స్లీప్ ప్రాపర్గా ఉండేటట్టు చూసుకోవడము, స్క్రీన్ టైం తగ్గించుకోవడము, ఆల్కహాల్ అవాయిడ్ చేయడం, వీటితో మేనేజ్ చేయొచ్చు. మెడిసిన్స్ లాంగ్ రన్లో అవసరం ఉండదు వాళ్ళకి.
So what we need to understand is seizure is not as dangerous as it is always thought about in the society, and it is most of the times curable, I believe, and
it's controllable.
Most of the things can be, if we can identify the cause, treat the cause, most of the times it is curable.
Yes.
And even if it is not curable, you take medicines,
controllable at least.
It is at least controllable. That's what we can conclude, I believe.
Yes, sir.
Okay. So thank you, Dr. Anitha. Thank you for the detailed discussion.